Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the knee. It is the dial test. Now, this test is actually got a pretty interesting background. So it was first described in a paper in 1991 by Dr. Richard Loomer. And he says that he is referencing another physician, Dr. John McConkey, who described this test first back in 1977. So the purpose of this test is to look at posterolateral instability of the knee. And it can actually test for that posterolateral instability and a PCL tear, or a combination of them. So it's actually got a little variations of things of how to do it, and it seems to have changed over the years, which we will talk about that. To perform this test, in the original article, what they did is they have the person lying supine. They flexed the knees and the hips up to 90 degrees, brought the knees together, and then externally rotated the feet. And they said, two ways that this test was positive. If there is more than a 10-degree difference of external rotation compared to the affected versus non-affected side, and the tibial tuberosity here, it sagged. So they said, okay, that shows that there is the posterolateral instability and a PCL tear. To do the variation, you have the person prone, flex their knees to 30 degrees, externally rotate. You're looking for a more than 10-degree difference on the involved side. You can then bring them all the way up and then test it again. Again, looking to see, do we have more than a 10-degree difference? And all of this can tell us different things. So if the person has more of that 10 degrees greater difference at 30 degrees, and it's pretty equal at 90, shows that, okay, there is that posterolateral instability. However, if it is more at the 90 degrees than the 30 degrees, there could be some instability in the PCL. But if it's, again, more on the 30 degrees and the 90 degrees, okay, there's probably a combination of them, or there's some other things going on as well. In getting into the research for this test, there is an article out there that they had 87 people who had a ligament injury, and they were going to go through surgery, and they did these tests on them to see how they did, and they found that the sensitivity was 20% and the specificity was 100%. So they said if the test is negative at 30 degrees, it is a very good way to rule out that that posterolateral instability. But if it is positive at 30 degrees and negative at 90 degrees, and that there is the posterolateral instability with a possible PCL injury as well. So they said if it is positive as well, make sure that you do the other clusters of tests to confirm what you got going on. So there you go. That is the dial test. Let me know, do you use this test? Do you like it? What variation of it do you use? Let us know down in the comments. And like always, take care of yourself. Take care of your patients. We'll see you next time.